Bariatric surgery is an empowering procedure for those who receive it. On today's episode, we will talk to one of Trinity Health Mid-Atlantic's best bariatric surgeons. She will help debunk the myths that are sometimes associated with this weight loss surgery. I'm your host, Margie Zimmerman, and this is Beyond the Stethoscope. Welcome, Dr. Trehan. Thank you for joining us today.
Thank you for having me.
Pleasure. Well, today we're talking bariatric. Can you tell us what is the simplest explanation of what bariatric surgery is?
Bariatric surgery is also called metabolic surgery, and it is a field of surgery where we have multiple procedures that essentially redesign the digestive tract to have a patient lose a large amount of weight over a long-term sustained period of time. And the end result is to have our patients live longer and healthier lives. And it's a surgery that's reserved for people who have a certain BMI or a certain amount of excess body weight. And it's done to either treat, prevent, or cure certain chronic illnesses that are associated with obesity.
Wow. What type of medical conditions would you recommend? If someone has a certain medical condition, who would you recommend to have this type of surgery?
So the surgery will usually benefit people who have type 2 diabetes, high blood pressure, heart disease, liver disease, sleep apnea, and various other medical conditions.
Wow, that's awesome. I know there's multiple types of weight loss surgeries. What are the most common that you see today?
So the most common bariatric procedures out there right now are the sleeve gastrectomy and the gastric bypass. And the sleeve gastrectomy is a procedure where we remove about 85% of the stomach, and the patient's left with a small stomach. And as a result of that, they tend to feel full quickly and they can't overeat. The gastric bypass is a little bit different. So in that procedure, we reroute the stomach and intestines so that the patient still has a very small stomach and feels full quickly. But we also skip over or bypass about 20% of the small intestines. So of the food that the patient does eat, fewer calories are absorbed.
Interesting. Why, in your opinion, are some of these surgeries controversial?
So I personally don't think that bariatric surgery is controversial. Just as somebody who has a large colon cancer, for example, needs a big surgery to help fix their problem and get their health back on track. Similarly, a patient who's 100, 200, 300 pounds overweight and they can't, move around the way they used to, or they're developing a lot of medical conditions, those people also need a big surgery to help get their health back on track. But there are some ideas out there that bariatric surgery is the easy way out, and that if a person with morbid obesity were to just, stick to a rigorous diet and exercise plan, that they would lose the weight.
It's not that easy.
It's
We
not.
both know that.
It's not that easy, and the science is starting to show us that obesity, especially at the higher BMIs, is not as simple as somebody who's trying to lose 5 or 10 pounds. So obesity is a hormonal disease. It's a disease of gene expression, and it does not respond to diet and exercise alone.
Once you have these surgeries, is it possible to go back, to eating more? You know how these surgeries, you're not supposed to, you're supposed to feel full. Do people ever is there something that they do that their appetite does increase again?
So the surgeries, that's a good question. So the surgeries we're finding actually, um, they reset the hunger hormones. And so one of the big advantages of the surgeries, both the sleeve and the gastric bypass, is that a lot of people come back and their appetite is decreased, and they're craving for foods, or their obsessive thoughts about foods that aren't good for them will decrease. But yes, in the long term, some of the restriction that we feel initially after the surgery might get a little bit, ease up a little bit. Um,
Yeah, that's good. I understand what you're saying. That's good to know. You explained it perfectly. Well, let's debunk the 5 myths around your specialty. Myth number 1: weight loss surgery, like you said, is just a quick fix. So, what is the difference between bariatric surgery and, say, liposuction?
That's a very good question because I think there's a lot of confusion about the difference. So, liposuction is a cosmetic procedure that's done by a cosmetic surgeon to make a particular part of the body look smaller. So, for instance, if you have, let's say, if you think you have too much fat on your arms, you could have a cosmetic surgeon go in with a tiny vacuum, suction out some fat, and instantly that part of your body will look smaller. Um, at most, people will lose 5 to 10 pounds from liposuction. And in the future, they're likely to regain that weight. And there's no major health benefit from that.
It's more
Bariatric,
cosmetic.
it's more cosmetic. Bariatric surgery is a much more intensive and holistic process. So in bariatric surgery, we redesign the digestive tract and we essentially reprogram the metabolism so that a patient loses weight from head to toe. And that's a really good thing because a lot of the fat that we store in our body, a lot of the dangerous fat that we store in our body is actually what we call visceral fat. And that's deep inside our abdominal cavity. And that's the fat that sits on our intestines and our stomach. And that's the fat that tends to make us more sick. Cosmetic surgery won't reach that fat. So, bariatric surgery is the only procedure where you can have a very strong or have a very effective weight loss that includes the visceral fat that makes us sick.
Thank you for clarifying
Yeah.
that. That's good to know. How long does the bariatric surgery take?
It depends on the surgeon and the patient. I would say most procedures take anywhere between 1 to 3 hours. After the surgery, patients tend to spend a night in the hospital. They usually will go home the first day after surgery.
Our second myth around this surgery is that it's pointless and most people will gain the weight back. How does our program continue to support patients post surgery?
So, what I tell my patients is you can expect to lose a large amount of weight in the first year after surgery. Most people will level off at around a year, and some people will gain a small amount of weight back. We see our patients at least once a year for life to help make sure that they're back on track. And if their weight is rising or if they're not happy with their weight, we will work one on one with them to figure out what the root causes are and help them get back on track.
Myth number 3: bariatric surgery only benefits patients that have hundreds of pounds to lose. What are your thoughts on this?
So it does benefit patients who have hundreds of pounds to lose, but there are some people who may have a lot of medical comorbidities and they may benefit just from losing 50 pounds. So it kind of depends on the patient's starting weight, their height, what their overall medical condition is, and it's not limited to only people who have hundreds of pounds to lose.
So, what if someone only had 50 pounds to lose? What are the requirements for someone to actually have bariatric surgery? Like, if they only have 50 pounds to lose, say they're not real overweight, but they would like to really lose 50 pounds. Do you recommend this for them?
So we try not to focus on the exact number of pounds that we want a person to lose. We tend to make the decision about whether or not a patient should have bariatric surgery based on their BMI. So that's the body mass index, and then their overall health picture. So, some people who are very tall or very large may have more pounds to lose, but somebody who's only 5 feet tall, for them to lose 50 pounds is similar to a taller person losing 100 pounds sometimes. So it's not about the number, it's more about the health benefit that the person will get from the weight loss.
Understandable. Myth number 4: the risk outweighs the benefits. What type of risks do you see that this surgery carries?
So bariatric surgery is extremely safe. It has been rigorously studied and
It's great
perfected
to know.
and protocolized, yeah, over the last 25 years. So it's not more dangerous than other surgeries that you would hear people getting routinely. The major risks that I talk about with my patients, though, are you can potentially expect to have bleeding after surgery, which is easily fixed. There can be leaking from the site of the intestines where we cut and sew the intestines.
But these
And
are all like like everything.
yeah, these are not meant to scare patients. It's more to educate them that there are things that can go wrong, as with any surgery, but the overall risk is very low. We rarely see major complications in our patients, and when we do, they're usually fairly easy to remedy.
What's the recovery for a surgery like this?
So after the surgery, people will spend the first night in the hospital, and then they'll typically be discharged home on a special liquid diet the
Or
day
how
after
long? How long will
surgery.
they be on that? I did hear about that. How long will
Yeah.
you be on the liquid diet?
So usually for 1 to 2 weeks, and then we slowly advance the patient's diet to soft foods and gradually get them back to regular solid foods. Um,
And how
they
long does that take?
that takes anywhere from 2 to 4 weeks.
Okay.
Yeah. Yeah.
So is there certain foods that they need to cut out? Like say, I guess they shouldn't eat the way they were eating before, probably.
Yeah, so
So
the
that's important, probably.
part of the preoperative requirement to have bariatric surgery is extensive nutritional counseling, and we do discuss healthy food choices, eliminating sugar as much as possible, eliminating processed foods as much as possible, and our patients receive a lot of education on this before they even have the surgery.
Our final myth. Most health insurance companies don't cover the costs. Is this true?
So, most health insurance companies do cover the cost for bariatric surgery. If a patient finds that their plan doesn't cover it, it is something that they should feel empowered to talk to their employer about and receive coverage, because the overall health benefits are very, very
Yeah, I
positive.
agree. I
Yeah.
would think that most insurance companies would cover something like this. It seems like it's necessary for a lot of people.
Yes.
Is there anything else that you would like our listeners to know about bariatric surgery?
Bariatric surgery is a very big commitment, and it takes a lot of effort and courage and organization in order to successfully go through bariatric surgery. So we like to make sure our patients know that it's not the easy way out. Sometimes it's absolutely medically necessary, and it's, something that we're really proud of our patients for doing, because they do very well and they benefit greatly from the surgery.
It's not a quick fix. It is something between the nutrition, counseling, and everything else.
Correct. Correct.
Well, Dr. Trehan, it's been a pleasure chatting with you today. Thank you so much for sharing all of your knowledge and expertise with us. We greatly appreciate it.
Thank you.
If you or someone you know would benefit from this procedure, or if you would like to know more about our bariatric program, please head on over to our website to learn more. Thank you all for joining us today. Please stay tuned for future episodes of Beyond the Stethoscope.